Welcome back to Sketches in Surgery. This is Earl Stephenson Jr., your Atlanta board certified plastic surgeon, and we're going to continue with episode 2 of sliding genioplasty. I appreciate you joining me. If you like this content, please like or subscribe depending on what channel you're viewing this on. It really helps me continue to build this content. So with that being said, here we go. We're going to focus today about the design and how to approach correcting a chin with a sliding genioplasty. In our first episode, we talked briefly about how to assess a client if they have chin issues versus jaw issues, and a little bit about how that is accomplished. This, we're going to talk about the design and approach. So with that being said, let's dive right in. So I'm going to turn over this direction, and so we're going to approach this. How do we approach a genioplasty? So obviously we're going to have this performed under general anesthetic. Sometimes it can be performed under IV sedation, and that's okay if you're equipped for that. I prefer general anesthetic. The incision is inside the mouth, so there's no external scar, so you don't have to worry about that. Typically it takes about 1 to 1.5 hours to perform, and typically in general it takes about 3 months for all the swelling to go down. You will have some numbness. Write that down. That may last 6 months to a year, but that should get better as well. So it's a fairly straightforward procedure performed under general anesthetic or IV sedation. The incision is inside the mouth. It takes about an hour to an hour and a half, really back to your complete self from a facial standpoint and an energy standpoint in about 3 months. And you may have some residual numbness of the chin, lower lip, and even the lower front teeth for 6 months to a year. Some people heal that quicker, some people a little bit slower. So it does not affect the movement of your lower lip. So that's the general outline of how it's done, where the incision is, how long it takes, what the recovery time is. So let's focus on the actual incision in the bone, because it is an incision in the bone using surgical saws. I know that sounds scary, but you're comfortable in sleep and numb, so you are well anesthetized. So once I get you anesthetized, we focus in on exposing the bone from the inside of the mouth. And what I want to do is I want to find the 2 nerves that give you feeling to your chin, and they usually come out right here, kind of near the or behind the eye tooth on the bottom, and they come out from the bone like so and give you feeling to the chin skin, lower lip skin, and they send a little branch to the teeth. So I want to find this nerve once I expose the bone so that I can protect it, so I can push it and kind of protect it and shield it, because I'm going to have to make a cut in the bone. And the cut in the bone I like to make is a fairly long cut. So I go underneath that nerve. Let's see if my marker will work with me. Oh boy, I need to get some new markers. I'm struggling. All right, so that marker's not working. On to this one. So I make a cut in the bone. I go below that nerve, and I'm below the roots of the teeth. So I do not want to injure this nerve, the mental nerve, so I protect it so that I can sweep it and make this cut across on both sides, and I make that cut well below the roots of the tooth so we can not injure those structures. And with that, I'm able to separate this portion of the bone from your lower jaw. On a side view, that looks like this. And I'm doing this very deliberately because I want to illustrate a point. Let me just finish up this drawing because, again, I want to illustrate a point. Just take that on around like that. And that's back towards your jaw. Okay, so you're like, well, why is this guy being so fussy about this? I believe that this is the best way to make your incision with a good segment of bone that's fairly lengthy. It's fairly lengthy. And why is that an issue? Because you don't want to make it too short where you end up with a notch. And you want to make it fairly parallel so it moves in one direction. So let me illustrate what I think is not a great incision. So I'm going to use a orange marker for that. I see a lot of genioplasties performed where the incision in the bone, the osteotomy, is like this. That, in my opinion, does two things. The bone moves in the direction of the cut. So now you're going to move the bone forward, but it's going to slide this way. So it's going to go forward and up, which is going to shorten your chin. And you may not want to do that. If you have an osteotomy that is just straightforward and it follows the line of the osteotomy, it's just going to move forward. It doesn't move in two directions, it moves in one direction. The second issue, as you move forward, you create a little bit of a notch right here. You get this step off right there. Let me zoom in because I think that's important. You get that step off with this osteotomy, this orange line. With the other osteotomy, let me correct that. Let me bring that back. With the blue osteotomy, you don't get that dramatic step off. It is not dramatic at all. And so you're able to camouflage that, especially back in this area of the jaw where you can't feel it or see it. If it's here in the front of the jaw, you can definitely see it or feel it. So again, what I like to do is I like to make my osteotomy more like the blue line and less like the orange line that I'm getting rid of. Because again, the bone moves in the direction of the cut. So if your cut is angulated, then the bone's going to move in two different directions. So we want to make sure that that occurs. Again, from a front view, if you have this wide or long cut as opposed to this kind of short cut, this is not what you want because it leaves you with a small chin button. It leaves you with kind of a gap right here where you can see very readily where there's a disconnect between the bone and the newly positioned chin. When it's this direction or this geometry, which is the better terminology, then yes, you have a little bone step, but it's back behind where you can see it and can't, and it's camouflaged. So it's important as the surgeon to make sure that you design the cut in the most appropriate manner. Once this is performed and moved in the direction that was determined pre-surgically, then this is secured with some bone plates and screws, and I'll show you those in another video. Once this is done, I typically sew this up in 2 layers. The first layer is repositioning the muscle to the bone so that we don't have droop of the muscle and the chin that looks commonly like a witch, especially on side view, which is called a witch's chin. If you don't reposition the muscle so that the chin and the muscular is repositioned in its natural state, then you'll have that droop on the side. You'll have a little bit more show of your lower teeth. You'll strain to bring your mouth together, as you hear me doing that in the video, and it's just very difficult to kind of overcome and deal with it on a daily basis. So it's really, really important that once this is completed, that the first layer of stitches or sutures are used to reposition the muscle. The second layer of stitches are on the outside or on the gum side of the incision, and they're sewn up. I usually use a dissolvable stitch such as a chromic suture. And so that's it. Once this is done, we put the appropriate bandages on and you're on your way. So again, in this video, I wanted to really hone in on just the general outline of the procedure from beginning to end, as far as surgery to healing, and then really discuss the cut in the bone, because it really makes a difference, in my opinion, on the aesthetic outcome. So with that being said, I hope you enjoyed this video. I welcome you back to watch more videos and sketches in surgery as we wait for our next episode, episode 3. We'll talk about forward advancement for sliding genioplasty. See you next time.